The National Foundation for Infectious Diseases says that vaccines are as important to your overall health as diet and exercise. Like eating healthy foods, exercising, and getting regular wellness visits, vaccines play a very important role in keeping all of us healthy. Vaccines are one of the most convenient and safest preventative care measures available. Vaccination can mean the difference between life and death. Hello, and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Vaccinations are important to people of all ages, but in this segment, we're going to focus on the youngest in our community, children from birth to age 18, and what vaccines they might need throughout their first stages of life. With us now is Dr. Kenneth Alexander, Chief of Infectious Diseases at Nemours Children's Hospital, to explain more. Hi, Dr. Alexander. Thank you for joining us.
It's a pleasure, as always.
I would imagine in your role as a pediatric infectious disease specialist, talking to the kids is important, but I would imagine you'd have to talk to the parents even more gingerly than you do the children. Tell us what you say to them about the importance of having kids vaccinated.
So vaccines are always a hot topic, and you're right. You know, what's the old adage? An ounce of prevention is worth a pound of cure.
Yes.
And in fact, for a lot of the diseases that we vaccinate for, we don't really even have cures. So it's been a real challenge over the past 2 years, as everybody's been so focused on COVID, to remind people that regular routine childhood vaccines remain very, very important.
Why are they important? Because we've had more back and forth over vaccines of any kind in the last 2 years than probably any time in history. So why are they so important for children?
The reason we vaccinate our children, there's really two reasons. First of all, to protect our children. The main reason we protect our children, we love them, and we don't want them to get all these horrible vaccine-preventable diseases. Second, we vaccinate our children to protect everybody else in the community, to protect adults and other vulnerable children. So there's really two reasons: protect our children and protect the people around our children.
So I'm assuming, at the risk of using that word, that you have some parents or caregivers of kids who push back. What is your best argument in the other direction?
You begin with the recognition that everybody wants to do right by their kids, right? Every parent wants to do what's right for their child. And then the question becomes, is vaccination right for my child? Here, unfortunately, there's been a lot of noise and a lot of misinformation that's out there. You realize that around the world, doctors vaccinate their children. 98% of doctors choose to fully vaccinate their children. So all the people that are talking about why I don't vaccinate their children, you know, that's a lot of noise from a very small number of people. So what I tell parents is that if you come to me, you're bringing your child to me because you love your child. What I'm saying to you is, I love your child, therefore my advice to you is vaccinate them to protect them.
So let's talk about the kinds of vaccinations that kids should have and at what ages. What are the basics in terms of vaccines?
The basic vaccines that you get as a young child, right? We really begin with your vaccines in the delivery room. That first dose of hepatitis B vaccine, because that protects your baby from the possibility of mother-to-child transmission of hepatitis. That's something we do around the world. Then at 2 months, we get a combination of vaccines that include things like polio vaccine, meningitis vaccines, all the different vaccines against pertussis, which is whooping cough, tetanus, and all those other important diseases that we don't hear about much anymore because we vaccinate against them. We vaccinate against rotavirus to keep your child from getting dehydration. And then when your child turns something over a year, usually at between 12 and 24 months, we give them MMR and chickenpox vaccine. Measles, bad disease. And I'd feel absolutely awful if in the middle of a COVID pandemic, we were dealing with a measles outbreak as well, because measles kills children. And then as you get older, right, we give your immune system a reminder before kids start to school. Again, a reminder dose of tetanus, diphtheria, pertussis, a second dose of measles vaccine. And then it's important as your children become teenagers, we are protecting them against HPV, so cervical cancer and head and neck cancer. We're protecting them against meningitis, and we're protecting them against whooping cough. So it's really part of a lifetime story. And now we're adding COVID to the deal.
So what if a parent misses getting their child one of the shots that you mentioned on that timeline? Is all lost?
Here's the good news. Your immune system remembers. Sometimes it takes a little reminding, but your immune system remembers. So if a dose is missed, maybe you don't get that 6th month or whatever dose of vaccines or something at a year, it's okay. Go back to your provider, your doctor, your nurse practitioner, your clinic, and get that dose when you can get it. The important thing also to remember is the old adage that a dose delayed is a dose that doesn't get given. So if you're given the opportunity to get your kid vaccinated, do it now.
So let's talk about side effects. With every medication that has ever been put out anywhere, there's a list of side effects. So what about parents who make that argument? Well, I don't want the side effects to be worse than what I'm getting my child vaccinated against.
That's an important question. And here what we have to do is separate wheat from chaff. In other words, there's the side effects that we observe in clinical trials where we have in this country, I think probably the best vaccine safety monitoring system in the world. And then there's all the stuff that's the noise on the internet that probably isn't true. And so the challenge that parents have is separating what are the real risks of vaccination versus what's all the noise I'm hearing on the internet. So let's go back to the good information. Part of what we have is a system that asks the question, is the risk worth the benefit? And this is what organizations like the FDA and the Academy of Pediatrics, the CDC, they worry about that. And there are the best minds in the world that deal with that question. And if a vaccine is recommended for your child, there have been a lot of really smart people ask the question, is the vaccine, the protection you get, worth the risk that's there? And the answer that they're giving is absolutely it is.
Now, we've heard about this trend of parties where parents actually bring an uninfected child in close proximity of another child who has, say, chicken pox or measles. Weigh in on your opinion on that.
It's like playing Russian roulette. I think that's a dangerous notion. There's the idea that these infections are benign. And in fact, let's take chickenpox as an example. Yeah, I got chickenpox when I was a kid. I'm old enough to predate the vaccine, but I can tell you that I've seen children die of chickenpox. So will most kids that get chickenpox be okay? Yeah, as a parent, you'll miss 10 days of work or so. The vast majority of kids will be great, but not everybody. It's not a guarantee.
So is there an argument that you have not come up with a counter for that a parent brought to you?
There's always the parent whose mind you can't change. But in many ways, that's an emotional decision, not a scientific decision. There's really no good, solid scientific evidence to say you shouldn't vaccinate your children. So what we're left with is people with emotional perceptions that say, I'm just not going to do this. And in the end, all the science in the world is not going to change these people's minds. I wish it would, but that's just not the way people work. Let me draw a parallel. Every cigarette smoker knows that cigarettes cause lung cancer and heart disease. But some people, no matter what you do, are still going to smoke. And that's the way it is in the vaccine world. The challenge we have is that in some ways, unvaccinated children are kind of like smokers. They put the rest of us at risk.
They put the rest of us at risk. Say more about that.
Well, imagine that if I took my child and sent them to school in second grade and said, sit down in the classroom and light up a cigarette, how would the other parents respond? Well, that's kind of like what an unvaccinated child does at school, right? They put the other children in the room at risk.
Dr. Alexander, we could talk about this forever. Unfortunately, we don't have forever. Thank you for answering some tough questions and hopefully swaying some people in the direction of science, if that is indeed what has kept them on the anti-vax side. And for those parents who have chosen not to vaccinate their children, at least there is more information that we've shared today. So thank you so much.
Thank you.
We will be right back. Immunizations continue to be an important part of our health care, even as we age. Joining us now is Dr. Vincent Hsu, Infection Control Officer with Advent Health, to tell us more. Welcome, Dr. Hsu.
Here, Annetta.
First of all, describe what you do in your job as an infection control officer.
Yeah, our job, or infection control officers, really aim to try to keep our patients, visitors, and employees as safe as possible, specifically against the threat of infectious diseases. You may be aware that when patients enter a hospital, there are risks that they have because there can be infectious diseases that can be transmitted from patient to patient. So that's one thing that we do. But we also guard against the issues, of course, of keeping patients safe against community-related diseases. So the outbreaks that have occurred, Zika, Ebola, and of course, most recently, the COVID-19 pandemic. So we also want to make sure that people are immunized, and we offer immunizations to our employees and to our patients, again, to try to keep them safe as possible.
So let's talk about immunizations. We know children get a series of immunizations. How important is it for adults to be vaccinated? This has become more than a health issue. It's a political hot potato. It's a personal rights hot potato. How important is it for adults, and especially as we age, to get vaccinated?
I think you hit it right on the head, Annetta. As people get older, their immune system wanes over time. Mm-hmm. We always think about the children's vaccinations, but it's also important to recognize that there are a series of adult vaccinations that we need to be getting on a regular basis. A good example is influenza that needs to be given every year because those viruses mutate every year, season to season. Pneumonia vaccines are also very important. Vaccines against shingles, herpes zoster is also important. We're no longer spring chickens as we get older, and therefore we are more susceptible to disease. And it is very important that vaccines be given to help reduce the chances of getting severe disease.
And then there are anti-vaxxers. So what do you say to people whose stance on vaccines is that I don't want anybody forcing me to get a vaccine. I'm doing the natural thing. What is your response to someone who says absolutely not?
Well, anti-vaccine sentiment isn't necessarily a new thing, although, of course, over the last year and a half or 2 years with the COVID pandemic, it's been much more visible. I mean, there are various reasons perhaps why they don't want to do it, as you mentioned. I think the most important thing is really to focus on what we know, what the data are. I mean, it is absolutely clear that getting your vaccinations do several things. Number one, it helps protect you, the person getting vaccinated, against getting severe disease. It doesn't may not completely eliminate, but it reduces that risk. And no one wants to get a serious illness. No one wants to get pneumonia. No one wants to get COVID-19 or shingles, for example. So it is important to, and many of the diseases, even though they don't necessarily cause death, may cause severe complications or problems later down the road. Shingles is a debilitating disease that can last for months and months and cause severe pain. But the other thing, of course, is thinking about your others, people that are around you. We know that if you get vaccines, and we know their work and they're safe, that not only does it help protect you, it also helps protect you from spreading it to others. If you live with a family member who is at high risk of disease, for example, or you live with a young child or someone who's immunocompromised, for the public at whole, it helps prevent spreading disease. So you're not doing a service just for yourself, you're doing it for the community. So again, I know that it will not convince everybody to do so, but, really, there are multiple benefits we have to think about.
What have been some of the most interesting responses you've gotten from people who say they won't get vaccinated? I have heard people say, well, I don't know what's in it, so I'm not going to take it. What have been some of the most interesting responses you've gotten?
Well, a lot of the responses that we've heard are just completely off the board. I mean, I guess if you want to say interesting from that standpoint, I mean, there's just no basis in truth. Like there's a tracker that's going to track my every move, or it has some sort of alien substance, and I mean, it's just absolutely equivocally false. I think the more things that we hear, of course, that may not be as interesting, but are prevalent, are that this is a very new vaccine, or we just don't know what its safety is. As for COVID-19, for example, we've now had years, at least over a year of experience, and even more. We know that it is safe, it is effective. We know that it prevents disease. So I think what we try to do as clinicians, as doctors, as healthcare professionals, is really to let the facts come out. There is a lot of disinformation about how vaccines, may kill you, or your risk of dying if you get a vaccine is greater. That's another very interesting but absolutely false narrative. We know that vaccines save lives. If it wasn't for the fact that we've had these vaccines for COVID-19, hundreds of thousands of more deaths would easily have occurred in the United States.
Well, there have also been arguments that a lot of anti-vaxxers would put forth that this thing, the vaccine happened too fast for us to know that it works. What's your response to that?
It is true that the vaccines were developed in a short period of time. We've never seen something come to market so quickly, but this was because there was a concerted effort by everyone, by the vaccine manufacturers, by governments, by nonprofit, by all the agencies, to really make sure that we get this thing tested. But I want to emphasize one thing: there were no shortcuts that were taken as it relates to safety. In fact, they really made sure that they enrolled a wide segment of the population. So Latinos, African Americans, male, female, they really tried to get as representative as possible of the United States, looked at every side effect that could occur, and really looked at those carefully, recorded them. Now, we do recognize that Vaccines do have side effects. All vaccines have some side effects. We recognize that, some of them may have been quite serious. You can remember the Johnson & Johnson vaccine causing some blood clots, but these are carefully monitored. We want to make sure that we let everyone know what those are, what the risk is. In general, the benefits of these vaccines for the vast, vast majority of people outweigh the risks.
So you talked about us not being spring chickens. Are there some vaccinations we should look at more as we cross that half-century threshold? You mentioned a pneumonia vaccine. That's one that I've not heard a lot about. Say more about that one. Because we know the flu vaccine varies from year to year depending on what the virus does. But is pneumonia, or does that one change as well?
Well, the pneumonia vaccine really only needs to be given once or possibly twice if you're over 65. There are newer vaccines that have come out actually as early as just this past year. And so the guidelines for how to use that changes. The one thing about pneumonia I do want to say is that even though it protects against several strains, 23 strains, there are well over 90 strains that do occur, so it doesn't protect you against every type of pneumonia. And really, the pneumonia vaccine only refers to a specific type of pneumonia called pneumococcal pneumonia. There are many other types of pneumonia for which we don't have vaccines. But again, as we age, our immune systems aren't working as well. And pneumonia is a very common disease. And I think all of us would say, wouldn't you want to get something that would reduce your risk of getting a serious disease such as pneumonia later in your life? And I think the answer for most people would be yes. That's the whole purpose of vaccines, is to get your body to produce antibodies so that if you were to get infected with a specific bacteria or virus, you're well prepared and would not get that disease.
So just very quickly, the financial toll on getting vaccinated, is there financial help for people who want to get vaccinated?
Yes. I mean, of course, if for older adults who have Medicare, there is provisions for financial coverage with insurance, and pretty much everyone over 65 is covered. We work very carefully with Medicaid too as well.
Okay. So there are options for the uninsured and underinsured. I wanted to make sure that people were aware of that.
We work on that, and of course, COVID-19 vaccines, just to be absolutely clear, is completely free for everyone.
Absolutely. Well, Dr. Hsu, thank you so much for an informative session. We learned a lot, and hopefully got everybody's questions answered. We will be back with more. Stay with us. No matter which side of the vaccination debate you're on, it's important that you get information. And sometimes it's hard to talk to the experts and the professionals. That's why we did this show in particular, because above all, we want you to stay healthy and keep your own special healthy connections. I'm Annetta Wilson. Thanks for joining us.